So thank you, Paul, for your kind words and for being a co-founder and the chief strategist of Partners in Health, Bill and Joyce Cummings, of the Cummings Foundation, senior officials, Dr. Gary Gottlieb, CEO of Partners in Health, Vice Chancellor Dr. Agnes Binagwaho, faculty, staff, students, friends, distinguished ladies and gentlemen. Good afternoon to you. Let me start with just a couple of stories. So Paul, how it happened that from Davos I am here today speaks in many ways to the importance of why we are here and what has gathered us all here, which is global health equity and the work you have done. It wasn't without problems, actually. I was in Davos up to close 9 o'clock Swiss time, Davos time. And I was bargaining because I had been told that Zurich airport, where we had our plane, shuts down at 11 o'clock. And the drive from Davos to Zurich city is about, on average, 2.5 hours. So I had to bargain very hard. I told our people, they kept telling me, you can't make it. Yes, there was a meeting I had to attend in Davos, and the people kept insisting I have to stay until that time, 9 o'clock. So we bargained, and I told our people to tell the authorities that were responsible that in actual fact, it's not that I am important myself, but what I'm going to do is very important. And then they came back to us and said, okay, we'll give you extra 30 minutes just for that. So we had to drive a bit fast, and we were there on time. And we took off just on the edge of the time they had told us we should be out or we stay overnight. Almost 2 minutes to the time. But there what I was saying was, and I was telling our people to tell the authorities that, you know, in Davos, from the beginning, we've been talking about inequities that exist in the world. And that what I'm going to attend to is a solution to those inequities, and it is so important that then we have to walk the talk. And I was referring to this university that we are here to inaugurate, and the work it is doing, the work it will do. So I'm very happy. We arrived around 8 o'clock in the morning, so just rushed to some place, had a quick shower, and drove here. So I am absolutely happy to be here with you. And let me once again congratulate all those involved in transforming this bold vision into the beautiful reality that we are inaugurating today. In particular, I want to extend our special appreciations to Bill and Joyce Cummings for their generous support and personal involvement over many years. We are happy to have you here with us today. The same goes to Bill and Melinda Gates and the Gates Foundation for their financial support for this project and their sustained advocacy for good health outcomes in Rwanda and around the world. Let me also say that Paul Farmer and the Partners in Health team, together with the Rwandan partners, have once again demonstrated that they follow through on their commitments and get things done. Your efforts are raising the standard globally on equity in healthcare. Partners in Health, known here as Inshuti Mubuzima, has been an important part of Rwanda's journey to better health for many years. They work with institutions to provide high-quality medical care in 3 hospitals, including the Butaro Cancer Center of Excellence, and the next door, as well as dozens of health centers. Such as important is our collaboration on scientific research to measure the impact of health interventions and continually improve the care that our citizens receive. This new cutting-edge university represents an additional investment in the human capital of Rwanda and our region. The name of the school, the University of Global Health Equity, tells us something critical about its mission. It is not just about producing highly skilled medical professionals, though that is, of course, the foundation. It is about first teaching students to put the human factor at the center of care. Hospitals don't treat diseases, they treat individual people, each in his or her social and cultural context. And second, emphasizing the importance of investing in and strengthening national health systems. Instilling those principles is essential for reducing the disparities in health outcomes, both within countries and among different regions. So we are proud to be associated with this institution, absolutely. Phase 1 is done, and it is very well done. But we have more work to do. And the government and the people of Rwanda are ready to keep working with you to sustain the momentum. There is a famous book, some of you, I'm sure, know about a certain doctor. It is called Mountains Beyond Mountains. Based on a Haitian proverb about how each achievement brings the next challenge into view. Each step forward builds our capacity to do more and better in the future. So we will keep climbing together. Let me, maybe before I close this, there is a story Paul did not tell you. Another kind of personal story connected with the work done around this university. Paul, one time, from Ruingwavu in the evening, I have a home between Ruingwavu and the city. So he was coming from Ruingwavu. He didn't want to pass without coming to visit us. So he came to our home, found us and the First Lady. So, and with Paul, when it's not work time, you know, we can chat until morning almost. So we had a good time, and it went up to near 2 o'clock in the morning. And he was driving himself in a pickup truck. So he, as we were seeing him off, he told us that he was actually driving to Butaro. And I said, Paul, you can't do that. You can't, in this is too late. I was not afraid that anything else would happen to him on the hands of wrong people on the way or something. But I told him, driving at this time, and he was driving himself, he didn't have a driver. So I said, no, you can't go. You've got to stay, either stay with us or stay wherever you want, but you can't go beyond the city. And he kept, he actually insisted. He said he was going. I said, you are not going. And so I told him, either I detain you here to stay with us, or if I let you go, if you have something to do in the city, I keep tracking your journey to Butaro. If you happen to go beyond the city, I'll tell National Police to go after you and get hold of you. In fact, that's what more or less happened. Because he insisted, and I knew he meant coming all the way. And I was asking him, I said, is there anything you're going to do in Butaro this time that can't wait until morning? No, and he says, no, he wanted the morning to break when he was there, when he was in Butaro, and all driven by the work they were doing here. So when he continued, I actually materialized my threat to stop him. So he was said, sir, we are told you've got to find some sleep tonight and go during the day in the broad daylight. So maybe we saved Paul for another day. to be able actually to be here with us also at the same time and continue with his good work. Let me close with a word about the diverse faculty and student body of this university. It is no exaggeration to say that the world has truly come to Butaro. We welcome you all and we'll do everything within our means to accompany you as you live, study, and serve amongst us. Please feel at home in Rwanda and consider our country as one among your own. Once again, our congratulations to all those involved in this impressive effort, and I know it is just the beginning. Thank you very much.